So this is how Virta got started. And the key technology here is you can do this safely in outpatients if you have constant communication and expert physicians and coaches managing that patient. Basically, this is a patient-centric program and a patient-centric app. This is not an app that's designed for billing, and we need to start learning how to do that, but it's really designed with having the coach in the upper right-hand corner and the doctor in the lower right-hand corner interacting with the patients, the patient monitoring data and logging it in through the app and getting access to their data through the app so they see all their data. And the other thing is putting the patient in contact with a peer support group, which augments the coaching process to allow them the comfort and security to know that they're doing the right thing and that other people are dealing with the same problems and communicate among themselves in terms of peer teaching. And these were people with type 2 diabetes. The average duration of their diabetes, which is important, was 8.4 years. It's much easier to reverse or treat or improve diabetes in people early on in their diagnosis, but when they've been at this for an average of 8 years, there's a lot that's been going on in the pancreas. These are tough patients to deal with. They were very obese. They had a BMI of 41. And the diet that we used with these patients was basically what we did with the metabolic syndrome study that I showed you that Jeff Volek and his team did. 1.5 grams of protein per kilogram reference body weight. Again, based on the observations of Stephenson when he was locked up in Bellevue Hospital. Because they were very insulin resistant and type 2 diabetes, we gave them only 30 grams of total carbs per day. And here's the important thing. We had them eat fat to satiety. This is not a calorie-restricted program. We did not count calories. We did not tell them to restrict calories. We told them not to be hungry. Eat to satiety. So we had in-person group training and management and in-person physician monitoring and so on, and the other half got this incipient app that we were developing, and I was sure the app wasn't going to work. We didn't see any difference in the first year between the two. Proved myself wrong. I like doing that because that's how I learn. We've published, these are 6 papers that we had published as of 2 years ago. We have another 3 papers published. If you read any one paper, read our 2-year data from Frontiers of Endocrinology, which shows that the 2-year data from our randomized clinical trial. I'll show you some of these data here. This answers the first question. Can people really stick with this kind of program? We had 83% retention at 1 year and 74% retention at 2 years. So excellent retention. And in the lower right-hand side of this diagram, you can see blood ketones that were being measured every day, reported through the app. And you can see that, again, this is a very insulin-resistant population, and yet the group mean ketone increase was up to 0.8, and they maintained that for the first 3 or 4 months, and they stayed at or above 0.5 out to 8 months. And even at the end of a year, they're about 0.4. So people can follow this diet, they can stay in nutritional ketosis if you give them the right information and adequate support to help them do that. It's tremendous benefit to adherence when people come off of their drugs and their weight goes down and they're looking at blood sugars that are better than anything they've seen in 8 years. That's remarkable.
Stated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.